What happens when you notice that you have the symptoms of depression? Well, the first thing you need to do is to inform your primary caregiver or your loved one or the person that you're staying with. It is also important to inform your mental health provider or your health provider. If possible, tell your caregiver and then make sure that you see a doctor who can refer you to either a psychologist or a psychiatrist, depending on how your condition presents itself and things like that. When you have the symptoms, do not isolate, do not keep quiet, seek help, do not be ashamed. This is an issue that is normal and has affected many people. The important thing is not to let yourself get pushed off the edge. Communicate to your care provider. Communicate to your significant other. Communicate to your health provider so that a treatment plan can be, can be tailored to sort you out. Sometimes even talking, even to your caregiver, may it even get you out of that slump. Sometimes it's just not even depression. Sometimes it could be sadness. So communicate, 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 talk, share. And even as you go to your health provider and you do, a treatment plan is prepared for you, ensure that, sometimes it could be a scenario where you may just need counseling and then the issue is resolved. It could be a scenario where you need a combination of counseling, medication, and complementary therapy. The important thing is to share what you're going through. Be mindful. When you notice that there is a trend in certain symptoms, do not keep quiet. If you notice you're having obsessive suicidal thoughts, make the call. If you notice that certain medications are misbehaving, causing you to feel a certain way because they are medications whose side effects are depression. If you notice your medication is not interacting with you as it should, communicate. The important thing is to communicate and to get the help necessary. Are there centers in Kenya where someone can get help? Yes, there are. There is church-based therapy, which is basically free. So you can go to a church near you and, speak to the counselors there who are willing to help. There is also, there are also centers like Amani Counseling, Befrienders Kenya, Tumaini Counseling. There's also the Red Cross toll-free line that can be called when you're having issues. Or, when you feel overwhelmed, there is the Red Cross toll line. There are church-based therapies. I know that Nairobi Chapel normally have a walk-in session from 9 a.m. to 4 p.m. every Wednesday. There are also psychologists and psychiatrists. That depends. If you want to pay, there are also, in every hospital, there is at least one or two psychologists or psychiatrists that can attend to you. That is if you're looking to pay. But the free centers, there is Amani, there is Tumaini, there is Hekima, there are church-based therapies. The important thing is to make sure that you reach out. And obviously, even as you go to for these therapies, all protocols COVID-19 are observed. So you don't have to worry about anything. So those are the centers. Make sure you reach out because it is important for you to be in a better space, especially in your sunset years.